The Ministry of Health confirmed that the American passenger who was suspected of carrying the swine flu virus after presenting with flu symptoms at Bahrain International Airport tested negative for the disease and was discharged from Salmania Medical Complex, stressing that the kingdom is more than ready to combat the illness. Earlier, we spoke with the Minister of Health, Dr. Faisal Al-Hamar, and here's what he had to say about the situation. As you're aware, Your Excellency, the World Health Organization raised the alert for the swine flu from a phase 4 to a phase 5 category. What does that mean?
Well, it means that we are moving towards category or level 6, if you like, which is really red alert. Now, when we move from 4 to 5, it means pandemic. It means also that we have to be ready and keep everything as far as the technology, medicine, the actual medical team should be alert at red alert level. So we should, in short, we should be ready for any kind of surprises.
In some European countries, Your Excellency, campaigns have been launched informing the public of the dangers of swine flu and suggesting ways to avoid infection by keeping good hygiene, washing their hands, covering their mouths while coughing or sneezing. Do you think at this stage Bahrain needs to launch a similar campaign, or is it too early for us?
Well, it's never too early. It's never too late. We have started this campaign many days ago. This kind of campaign, this kind of precaution should be remembered and should be practiced on daily basis. Trying to get out of heavily crowded area, maintaining a healthy kind of practices like covering your face when you are sneezing, eating healthy food. It will do you good. If you eat some if you take some vitamins, that will mean you are in reality boosting your immune system, and that has a good impact on your resistance to this kind of virus or any kind of virus. And to be honest with you, this kind of practice should always be there, part of your daily life.
Finally, Your Excellency, with regards to the suspected case of swine flu that has been detected at Bahrain International Airport, could you please tell us more about the nature of this case and what has been done by the concerned authorities?
Well, thank you very much. You see, I'm happy to say that Minister of Health confirms, and I repeat, confirms that the suspected case, which was admitted to the isolation ward at Salmania Medical Complex, was confirmed negative. I repeat again, confirmed negative for H1N1 virus, swine flu virus. The American passenger who arrived in Bahrain from United States via Frankfurt Airport was having symptoms of flu. We are talking here about flu and sore throat and the rest of the symptoms. He was immediately admitted into the isolation ward in Salmania Medical Complex by highly trained ambulance crew. And we have run some some tests. The X-ray investigation showed some chest changes. However, the blood test for the virus showed negative for H1N1 virus, and he was discharged this afternoon. I want to say that the professional way in which the responsible team dealt with this matter reflected a high level of dedication and professionalism. In reality, this was a golden opportunity for us to test our equipment, to test our technology, the protocol, the facilities, our dedication, readiness, and hopefully, and thank God, we passed this test with flying colors. I take this opportunity to assure the citizens as well as the residents of Bahrain that the Ministry of Health is ready to face this invasion of swine flu, I wish to say that it's really important for us to take care, as we said earlier, to take care of ourselves as far as the eating what you call healthy meals and vitamins to boost your immune system. This is really important for us. I'd like to assure all of us. I'd like to assure all of you that the Ministry of Health is dedicated to this problem, and we are ready with the necessary technology and armed with adequate and available medication to support anyone who thinks that he's running some fever or he's not doing well as far as this method is concerned. What I would also advise is that if any one of you who feels slightly under the weather with some fever, I would advise them to check in one of the health centers or come straight to the Sammani Medical Complex for treatment.
All right, thank you very much, Your Excellency, for talking to us and updating us on the matter.
My pleasure, thank you.
The Geneva-based World Health Organization has raised its pandemic alert for swine flu to the second highest level, meaning that it believes a global outbreak of the disease is imminent but not inevitable. WHO Director General Margaret Chan told a news conference in Geneva that all countries should activate pandemic flu plans and called on governments and health authorities to be on high alert for influenza-like illnesses and pneumonia. The decision could lead the global body to recommend additional measures to combat the outbreak, including asking vaccine manufacturers to switch production from seasonal flu vaccines to a pandemic one. While global health authorities warned that swine flu is threatening to bloom into a pandemic, Asia stayed on high alert but free of confirmed swine flu cases. Governments kept up strict health checks on travelers arriving from North America that were rushed into place this week as the disease spread quickly from Mexico. Asia so far has escaped infection, though South Korea says it had one probable case, with final test results still coming. In Japan, 70 medical doctors and nurses from Japan's self-defense force tagged along with the quarantine team at Japanese biggest international gateway, Narita Airport, and officials in Hong Kong and Australia said they are tightening screening to keep out the virus. In Luxembourg, European Union health ministers held emergency talks to coordinate efforts in preventing the spread of swine flu in Europe. The ministers approved a set of rules for how to identify the new form of swine flu as part of its bid to stop the disease raging out of control. Professor Angus Nicol, senior expert at the European Centre for Disease Control, said that a pandemic virus can change over time and that they can be very variable. He noted, however, that Europe was well prepared for any pandemic and that planning had already been done over the last 4 to 5 years.